Rabies is a deadly virus that spreads to people from the saliva of infected animals. The rabies virus is usually transmitted through a bite. Animals most likely to transmit rabies are dogs, monkeys, bats, cats, coyotes, foxes, raccoons and skunks, cattle etc. 90% dogs are the most likely to spread rabies to people. Once a person begins showing signs and symptoms of rabies, the disease nearly always causes death. For this reason, anyone who may have a risk of contracting rabies should receive rabies vaccinations for protection. Symptoms and causes. Usually there are no symptoms of rabies for several weeks after it enters in the body. After some weeks, 2 to 12, rabies virus attacks CNS central nervous system, prodromal phase, patient may experience flu-like symptoms. In the final stages it attacks brain and spinal cord and it grows rapidly. The patient may become paralyzed, go into coma and ultimately death. Later signs and symptoms, prodromal fever, fatigue, headache, cough, sore throat, muscle pain, nausea and vomiting, diarrhea, pricking or burning sensation, paresthesia at the wound. Site agitation, anxiety, confusion, difficulty speaking and swallowing, excessive salivation, hallucinations, partial paralysis, insomnia, fear of water drinking, hydrophobia, fear of air being blown on the face, aerophobia. Why there is no cure for rabies? There's no cure for rabies once it's moved into brain because it's protected by blood-brain barrier, which is a layer between brain and the blood vessels in head. Its job is to protect brain by keeping toxins and other dangerous substances from getting into brain from blood. It's like a very fine strainer. Researchers aren't sure how, but rabies locks this barrier down even further, so medications that might destroy it can't get through. Does rabies cause a fear of water? People used to call rabies hydrophobia because it appears to cause fear of water. The reason is that the infection causes intense spasms in the throat when a person tries to swallow. Even the thought of swallowing water can cause spasms, making it appear that the individual is afraid of water. Symptoms of rabies in animals. Animals may have trouble in swallowing, excessive salivation, becomes aggressive, the animal appears lethargic, the animal may get paralyzed. What to do after bitten by an animal? Don't panic. Wash the wound under running water with soap. Use iodine on the wound or some antibacterial cream to prevent the spread of the virus. Contact doctor as soon as possible. Diagnosis and tests. At the time when animal bites, there is no way to know whether the animal has transmitted the rabies virus. Talk to doctor as he/she will examine wound and ask certain questions. Doctor may recommend certain tests like saliva test. Patient spit into a tube, then the tube will be sent to a lab to look for signs of rabies. Skin biopsy. A small sample of skin will be taken from the back of neck which will be sent to a lab to look for signs of rabies. Cerebrospinal fluid test. Lumbar puncture needle will be used to take a cerebrospinal fluid, CSF, from lower back and then CSF sample will be sent to a lab to look for signs of rabies. Blood tests. Needle will be used to take blood from arm and then blood will be sent to a lab to look for signs of rabies. MRI to take the picture of brain which will help to determine the causes symptoms. Rabies vaccines are of different types and brands. There are different dosages accordingly. Normally the dosage is 1 milliliter or 2 milliliters. The doctor will take into account the age of the patient, the place of dog bite, How much time has passed since the bite? What is the condition of the patient? Keeping all these things in mind will decide how many doses of vaccine to administer. Doctor will also decide the schedule for vaccination. However, the course of rabies vaccine is of 6 injections. First vaccination on the day of dog bite, second after 3 days, third on 7th day, fourth on 14th day, fifth 28th day and last after 3 months, 90 days. Precautions. Get pets vaccinated against rabies and make sure your pets' vaccinations are up to date. Don't let your pets roam free without supervision. Stay away from stray and wild animals. Spread awareness about rabies and dog bites. Don't touch injured animals or try to capture animals yourself. Report strays to local authorities. Contact local animal control officials or police departments regarding stray animals. According to WHO, rabies is estimated to cause 59,000 human deaths annually in over 150 countries, with 95% of cases occurring in Africa and Asia. Due to underreporting and uncertain estimates, this number is likely a gross underestimate. The burden of disease is disproportionately borne by rural poor populations, with approximately half of cases attributable to children under 15 years of age. WHO continues to promote human rabies prevention through the elimination of rabies in dogs, dog bite prevention strategies, and more widespread use of the intradermal route for post-exposure prophylaxis, which reduces volume and therefore the cost of cell-cultured vaccine by 60% to 80%. To be continued in next video.